Let's talk about what's involved in a sub-pec to pre-pec transition of your breast reconstruction. I do a lot of these because patients are really just unsatisfied with the under the muscle reconstruction for a multitude of reasons. The animation that they have when they move their arm, or maybe it's uncomfortable, or in some cases it actually pushes the implant down and out, which just looks unnatural. Regardless, here's what's involved. So first we have to access your implant, which is under the muscle. So we take that out and then we put back the muscle as close to its original anatomical position as possible. Now I tell patients I wouldn't anticipate an increase or a decrease in muscle function because usually when that implant's been under the muscle, it's kind of been stretched out over time, but I do repair the muscle. Then I put the implant in place. Now, a couple of things to think about. One is that when I destroy that connection that's been made between the pec muscle and the overlying mastectomy flap, it's basically like redoing your mastectomy. So if your mastectomy flaps are very thin, and I can usually tell that on physical exam, we might actually consider doing this in a staged approach with a tissue expander because of concerns of blood flow to the mastectomy flap. There were blood vessel connections that have been created over time between the pec muscle and the mastectomy flap, but I just got rid of all of them. So that's something to think about. The next thing to think about is if you're trying to tell how thick your flaps are, you can't just pinch up here because you have pec muscle. You really have to pinch on the lower pole of the breast, and that will give you an idea of how thin your flaps are. The other thing we need to talk about is that now that I've recreated this pre-pectoral or above the muscle pockets, the implant needs to make a new home. So usually I will use mesh unless I'm doing a tissue expander, and I do use drains. So I tell patients this is a little bit of a bigger surgery, but it really can help that animation deformity and can alleviate some of that discomfort you're having from under the muscle. If you've had a sub-pec to pre-pec, let me know your thoughts below and let me know what questions you guys have.